All right, and today we'll be doing the CV-4 hold on our patient. For this, we want to be normalizing the primary respiratory mechanism after having palpated the rhythm of their craniosacral movement. For this, we'll be using the thenar eminences on our hands, and we'll be making sure that these make contact with the occipital condyles on our patient's skull. We want to make sure that we know first where the occipital condyles are and know where the mastoid processes are. We do not want to be going on the mastoids, we want to be going on the occipital condyles, so it's always good to make sure. With this being certain, we'll have our patient lay down on their back so that we can get set for the CV-4 hold. For this, we'll make sure the patient is far enough down that we can get our upper extremities firmly onto the table. We will lift our patient's head into our hands and find those occipital condyles that we found previously and put our thenar eminences onto the just inferior to the occipital condyles. We can also use our thumbs to palpate the mastoid processes. We can also tuck our thumbs behind if we think that that gets a better hold onto the occipital condyles. Once we are sure that we are in the correct spot, we should be able to feel the flexion and extension of the occiput as it goes through craniosacral rhythms. With the CV-4 hold, we will be encouraging extension, which moves towards me, the physician, and resisting flexion as the occiput moves away from me. This will occur 10 to 14 times a minute, as stated previously, and we'll be encouraging this until we reach a still point. When we reach the still point, we'll feel the occiput no longer go into extension or flexion. It will stop for a short period of time. Then it will restart into flexion extension and will hopefully have normalized at that point. We will then be able to release our patient from the CV-4 hold and reassess them.